Good evening, sir. This evening, I'm going to demonstrate the prenatal care and Leopold's maneuver. Procedure number 1. Identify and explain the procedure. Um, to prevent errors, this enhancing client to be cooperative and fan his confidence. Procedure number 2. Assess client's health history, which includes personal, family, social, previous obstetrical, and present obstetrical data. Information gathered by the healthcare provider will help establish baseline data and identify teaching needs. Number 3, um, assess client's knowledge on guidelines for health pregnant and antepartal care. Provide baseline data to identify teaching needs, serve as baseline data for succeeding prenatal care. Um, Number 4, review the plans for antepartal care visits, examination, and laboratory findings to serve as baseline data for succeeding prenatal care. Number 5, vital signs of client provide a baseline data for future comparison and identification of factors that may place clients for risk of problems. Number 6, measure the height on the initial visit and monitor it on succeeding visit. Weighing is an important part of each prenatal examination. A gain or decrease in weight will affect the pregnancy. Number 7, conduct physical examination. Uh, Begin assessing from head to toe to come with the general expression of women's health and well-being. Number 8, uh, instruct the client to empty or void her bladder to promote comfort uh, on on the part of the client. Number 9, position the client in dorsal recumbent. Um, Proper positioning relaxes both mother and baby. Uh, this also facilitates the AC location, presentation, and lie of the fetus. So the number 10, drape client and expose the abdomen from the level of sex void process down to the symphysis pubis to provide privacy. Number 11, measure the fundic height using tape measures starting at 0 centimeter to determine the gestation and growth of fetus. Uh, Number 12, the centimeter side of tape measure must be facing the abdomen while the inch side is facing the examiner. This is to prevent bias. 13, locate the highest point of the fundus. Leave one hand and place and secure the end of the tape measure uh, to the fundus. Measure to the top of the symphysis pubis. To measure the fundic height correctly. So number 14 is to document the measurement in centimeter to compare the calculated gestation. Uh, Tama ba? Tama. Number 15, perform the Leopold's maneuver to assess the condition of the fetal presentation. Number 16, warm two hands by rubbing one against the other before placing them to the abdomen. The use of warm hand during the palpation prevents tension and hardening uh, uh, of the abdominal muscle, favoring the good result. So number 17, uh, perform the 4 maneuver. During the first 3 maneuver, the examiner stands outside of the client, bed, and faces the client. The position favors the accurate performance of the maneuver. So, number 18, the first maneuver of the fundal grip. With both hands, palpate the upper abdomen and fundus for um, A. Consistency. Head is round, hard, breech is well defined. B. For the mobility, head moves independently, uh, breech less mobile. To determine the fatal part lying in the fundus. Number 19. The second maneuver, umbilical grip. Uh, with both hands moving down, palpate the side from the uterus from the top to bottom. One side smooth, hard, uh, resistant surface is the back, and the other side angular uh, modulation, knees and elbow. To determine the fatal back of fatal heart tone, usually found in the left lower quadrant. 20. The third maneuver, pollex grip. With the right hand over the symphysis pubis, identify the presenting part by grasping the lower abdomen with thumb and fingers. Assess the whether the presenting part is engaged in the pelvis. If head is engaged, it will not move. If it's soft, it is the back. So to determine engagement of the presenting part, uh, so 21, the fourth maneuver, pelvic grip. Uh, the nurse alters the position by turning towards the patient face and with both hands assess the the descent of the presenting part by locating the cephalic uh, prominence of brow. Place your fingers on both sides of the uterus about 2 inches above the inguinal ligaments. Press downwards and inwards. If the fatal back is palpated, uh, it means no obstruction. The other hand means obstruction. The fatal brow is palpated. To determine the degree of defection of the fatal head. So, 22, reposition the client uh, to make the client feel comfortable. So, 23, administer the TT or tetanus toxoid vaccination following the recommended schedule. So, for uh, uh, TT1, give as early as possible. For TT2, after a month later. So, si TT3, at least 6 months later. TT4, at least 1 year later. And TT5, at least about 1 year later after the TT4. Prevents both the mother and newborn from tetanus. 24, administer the iron foliate supplement until the second month postpartum to regain iron loss during childbirth. 25, administered malaria, uh, administered malaria, prophylaxis, to all pregnant women in endemic area. As the order by the doctor, give 2 tablets of chlorine phosphate, uh, about 250 mg every week. Uh, about the duration of pregnancy. Women are most likely to develop malaria when pregnant. The malaria can cause miscarriage, premature labor, and small baby, and also stillbirth. So, uh, 26, provide and promote health teaching and good teaching and personal hygiene and rest well and sleep to ensure the optimum environment for the health grown environment. Discuss with the client about her expectation about the pregnancy. There's us to include the danger sign and labor, delivery, and the impact of the family. So psychological assessment is important to assess the client and to identify areas of the need to ensure to the optimal fetal growth for the development. For 28, plan with the mother the preparation for best feeding the baby to know the advantage of breastfeeding to the newborn. So 29, discuss the importance of the prenatal of the and also the subsequent visit for the follow-up care. So that's all, sir. Thank you.